This video will review how to calculate cerebral perfusion pressure. This is for our patients with traumatic brain injury from Chapter 22. So to review, cerebral perfusion pressure is the pressure gradient that drives cerebral blood flow. This will deliver oxygen and other nutrients to the brain. Normal cerebral perfusion pressure is between 50 and 150, and normal intracranial pressure is between 5 and 15. The way that we calculate our cerebral perfusion pressure is our mean arterial pressure minus our intracranial pressure. And our mean arterial pressure is calculated as 1/3 of the systolic value of blood pressure and 2/3 of our diastolic value. So to go through an example using normal values, so if we have blood pressure of 120/80 and an intracranial pressure value of 10, our mean arterial pressure will be 1/3 of 120 and 2/3 of 80 to give us a value of 93 as our mean arterial pressure. And then we're going to subtract our intracranial pressure of 10 to give us a value of 83 as our cerebral perfusion pressure. And this falls in our normal range. Now, if we're talking about a patient who has elevated values from a traumatic brain injury, their blood pressure is 180/100 and their intracranial pressure is 20. Our mean arterial pressure will be 1/3 of 180 plus 2/3 of 100 to give us a mean arterial pressure value of 126. And we're going to subtract our intracranial pressure of 20 to give us a value of 106. Now 106 still falls in the range of normal cerebral perfusion pressure. However, if we remember from class, we said that research showed that if individuals had a cerebral perfusion pressure of 70 or less, they would have a 35% reduction in mortality, and these are specific to individuals with a traumatic brain injury. So even though the value of 106 is within normal limits, it is still elevated and leads to poorer outcomes in this patient population. So I hope that you have a better understanding of how to calculate these values and understand what they mean. This may be something that you might be asked to do on the exam.